My name is Richard Michael Gore. I'm a radiologist at North Shore University Health System in Evanston, Illinois, and it's part of the University of Chicago Health System Network. I like radiology because you're a wonderful diagnostician. You know, you're a detective where you have to put together certain radiologic data and try to make a diagnosis. And so I think being a detective is the most interesting part of being a radiologist. I've been called the Baron of VMS, the Duke of Duty for some reason. No, I've always found the abdominal organs very interesting, and you've got both the solid and the hollow abdominal organs. And I remember in medical school, for some reason, I found it very interesting. And also during my clinical internship, and also during medical school, I found GI Radiology, or GI, the most interesting part of the body, for some reason. But I think it's a very nifty part of the body. The book is called Textbook of Gastrointestinal Radiology. It's in its 3rd edition, and we're now planning the 4th edition, even at this very meeting. And the nice thing about this book, it's actually it's 2 volumes. The first volume deals primarily with the hollow abdominal organs, that is to say the esophagus, stomach, duodenum, small bowel, and colon. Whereas the 2nd edition, or the 2nd volume, deals primarily with the solid abdominal organs, the liver, the spleen, the pancreas, and the retroperitoneal structures that relate to the GI tract, and also the intraperitoneal structures as they relate to the GI tract. And the nice thing about it, it has both barium and also CT, ultrasound, MR, PET, functional imaging as well. And so there's going to be even more of that in the 4th edition. The first edition actually came out way back in the year of 1993, and barium was almost king still at that time, and CT and ultrasound and MR were up and coming at that point. And now I think barium has plateaued, and now CT, ultrasound, and functional imaging of the abdominal organs and the GI tract are really up and coming, and that's what we're trying to capture in the 4th edition of the book. We're still going to keep all the basic knowledge of barium radiology of the hollow abdominal organs, but we're going to be talking about functional imaging in terms of PET-CT, diffusion-weighted imaging, perfusion imaging, and these will all be included in great detail. And because this is the way medicine is going, we're individualizing therapy for cancer patients, and that depends upon functional imaging. And this is, was unheard of 10 years ago, and now we can actually individualize therapy for different patients with different tumors. And so that's part of the fun of doing the 4th edition. The ideal audience is probably radiology resident, fellow, and also attending radiologist. There'll be something for everyone in there. And also for medical students who just want to learn, the anatomy of the abdominal organs, both the hollow and the solid. I think it's a good resource as well. But the primary focus is for residents, fellows, and attending radiologists. We have surgeons in our department and gastroenterologists who also find the book very useful as well.